Hey everybody, we're going to talk about respiratory diseases today. We have talked about the respiratory system. You guys have done a debate over um, smoking and vaping, so you learned a little bit about how it impacts the respiratory system. We're going to talk about other diseases of the respiratory system. We're going to quickly review the respiratory system because it has been a few days since we have done that. Remember that the respiratory system is responsible for respiration on the mechanical level, which would be ventilation, inhaling and exhaling. Ventilation is the flow of air between the outside and the lungs. Inhalation basically is bringing oxygen in to the lungs. Exhaling is taking that carbon dioxide out. External respiration is basically just breathing. It's that exchange of carbon dioxide and gas through the pulmonary circuit of the respiratory system, which you guys should remember. That would be external respiration. Internal respiration is oxygen and carbon dioxide exchange on the cellular level. So that's when after that's on the systemic part of circulation where the once that oxygenated blood comes into the left side of the heart and goes out through the aorta to the rest of the body, it delivers that oxygen to the cells, the tissues, and then it picks up that carbon dioxide. So I just wanted to go over that really quickly. Now, this is a slide that's important because you guys are going to be doing vital signs soon. So you need to know what the normal respiratory rate is. I would be sure that I remember this slide. I would take notes. On my notes, I would definitely write this down. So, respiratory rate by age group, because you guys are going to need to know if it's a newborn that their respiratory rate is 30 to 60 respirations per minute. A 1-year-old, the average respiratory rate is 18 to 30 respirations per minute. A 16-year-old is 16 to 20, and for an adult over the age of 16, it would be 12 to 20 respirations a minute. So as you're checking those respiratory rates, you want to know if it's normal. So be sure that you know the respiratory rate. It'll be on your test as well, the normal respiratory rate for people based on their age. Upper respiratory disorders we're going to talk about. We're going to talk about the common cold, sinusitis, nasal polyps, sleep apnea or snoring related to sleep apnea, hay fever, tonsillitis, pharyngitis, laryngitis, because that is part of the respiratory system, and flu. Those are upper respiratory. We're also going to talk about lower respiratory disorders. This particular slide compares all of those different things based on what you see along with them: allergy, cold, and flu, how long what their onset is, how long the duration is, whether it's what season you see it the most, do you run fever with it. So know those, be able to compare those, be able to know which ones of those are signs and symptoms of allergy, cold, and flu. That way you can be able to determine the difference. So be sure that you read through and you know that with an allergy, nasal drainage is common and it is clear. With a cold, it can be yellowish to greenish. And with the flu, it could be anywhere from clear to green. That sometimes with allergies, they have some chest discomfort related to congestion. With a cold, it's mild to moderate. And with the flu, it can be severe. Cough is normally dry with allergies and a cold, and it can be dry, hacking, and sometimes productive with the flu. Vomiting, rarely do you vomit with allergies. Rarely do you vomit with the cold, but it is common with the flu. So be sure you're able to tell those apart. Let's talk about the common cold itself. There are more than 200 strains of the flu. And then the flu is the common cold. And know that there are, with 200 strains of the common cold, we are capable of getting over a cold and getting a cold right afterwards. So know that you can have one strain of cold and pick up another strain of cold the week later. With the flu, we generally have flu A and flu B. If I have flu A this season, I'm most likely not going to get it again. If I have flu B, I'm most likely not going to get it again, because there's not hundreds and hundreds of strains of flu. But with the cold, there are 200 different strains of flu, and based on our age also determines how severe it is, but it is possible for us to get another strand of flu. Also know that with any respiratory illness, the very young, the very old, and people with immune disorders, they are the people who are most susceptible, but it's also the most severe for. A newborn doesn't have, or an infant does not have, a really well developed immune system. Also, babies can't cough. They don't know how to cough yet. So, a newborn baby who gets a cold, it could be fatal to them because of the respiratory, because of the mucus production that they don't know what to do with. They can't cough it up. So, it's very important that if someone does have a cold, that we make sure that we instruct, or that we make sure that we stay away from very young children, because it can be. It's the same way with people who are elderly. It can cause more problems. It can cause pneumonia. If someone has COPD and we give them a cold, also could cause pneumonia. So in the weak and the elderly, we have to be very cautious if we have a cold. Unlike other diseases, there's no real immunity to the cold, and so another strain of the virus is always ready to be able to be picked up from someone else, and we can continue to spread those along. Common cold symptoms, usually it's an acute inflammation of the membrane lining, so we can have a stuffy, runny nose. We can feel tired. We can have weakness. We can have all kind, cough, congestion, runny nose, watery eyes. All that generally does happens because with a cold, our upper respiratory membranes, the sinuses and the nasal membranes, they all get inflamed, and what that does is that causes mucus to back up, which either causes our ears to stop up, causes lots of drainage in the back of our throat, or causes lots of nasal drainage. If there's a lot of pressure in the nose and the sinuses, lots of times our eyes will drain. We'll have sneezing and coughing and just kind of feel bad. We don't generally run a fever with a common cold. And so those are things that we have to think about, because a antibiotic will not help a virus. So if we go in, most of the time the doctor with a cold, the doctor won't give us an antibiotic. They'll tell us to use a nasal spray, or they'll tell us to take cough medicine if we need it, maybe to take something that thins out mucus. Those are kind of things that we take. Sinus infections, or sinusitis. So in our skull, I want to take my glasses off for a minute. We have sinuses that are above our eyes. We have sinuses that are above the eyes. We have them near our lacrimal ducts, or our tear ducts here. We have a set of sinuses that are on each side of the nose, and then we have some here in the cheek. And so when those sinuses get infected or get clogged, then we have other issues, and we can get an infection, inflammation and infection. Generally, a person has about 1 in 7 people is going to have at least one sinus infection a year. So those paranasal sinuses, they'll drain into the nasal cavity, causing either a lot of drainage or a lot of stuffiness and pressure. Generally, they'll cause a headache. The mucous membranes get really irritated. Children have a tendency towards having mostly a runny nose, and just these the ethmoid, or right behind here, the nasal sinuses will be there. They'll be most commonly affected with an adult. It can be all sinuses, so they can have their the sinuses over the eye and all down the nose and into the maxillary area. They can all be congested. So just know that it will change the way they sound. It will change. They may have a cough, but it's generally a dry, non-productive cough, unless the drainage is in the back of the throat and they're coughing that drainage out. It's not necessarily from the lungs. It's all in the head. Sinus infections, colds are generally all in the head, not necessarily in the chest. Generally, we see bacteria and virus-related sinus infections. Most doctors will treat you like it's a virus for a week, and then after a week, if it's not better, they'll go ahead and give you an antibiotic. Most people have a lot, so remember that they have a headache, runny nose, Sometimes they'll run a fever with a sinus infection sometimes. And they'll feel like their nose is kind of stiff and swollen all in the nose and right around the eye. Sometimes the eyes will be puffy. Sometimes the sinuses are so swollen that the eyes will actually drain. Treatment, it's going to depend. It may take you 2 or 3 weeks to get over a sinus infection. Once again, normally, initially, they will treat it with decongestant antihistamines, which means they're going to tell you to take Benadryl or Allegra or something like that at first, along with a cough medicine. And then after that, if after a week, if it's not better and you're still running a low-grade fever or running fever, they'll go ahead and prescribe an antibiotic. There are times people have to have surgery on their sinuses. The sinuses become impacted and they won't drain. After a month, they're still full, and so they'll have to go in and drain those sinuses. Not often, but it does happen. Nasal polyps. That would be a growth inside the nose or in the nasal passageway or in a sinus. Certain chemicals found within these polyps suggest that they may be caused from tissue formation, from allergens. They can be caused from other kinds of sensitivities to chemicals. Individuals with asthma and frequent nasal or upper respiratory issues have them more often, along with children with cystic fibrosis. Large polyps can cause the need for drainage, excessive drainage. They can cause sleep issues. They can cause you to have changes in your vocal resonation because your sinuses have a lot to do with your voice. And so sometimes they use steroid kinds of nasal sprays to try to decrease those polyps. If that doesn't work, sometimes they have to be removed. Another thing that's we often see in the healthcare facility is obstructive sleep apnea. So obstructive sleep apnea is where during a person's sleep cycle, they will stop breathing for a certain amount of seconds. And it'll do it a certain amount of times a night. It's not due to a foreign object, like something that they inhaled. It's due to displaced parts of the septum or sometimes due to body weight. People who are morbidly obese or very obese, sometimes the pressure of the weight on their upper body when they lay down, it causes them to have sleep issues. It's seen more often in middle-aged men than women, especially, but obesity can cause it in anyone. A deviated septum would be you have a septum here in the bottom of your nose, and instead of it being straight down the middle, it will be off center, which when you sleep, it will obstruct part of the airway. 4 out of 5 episodes of sleep apnea. So it's 4 or 5 episodes of sleep apnea, and it may last a second up to a few seconds. There are people who can have 1 to 500 episodes of sleep apnea in one night. When that happens, they need to put them on something called a CPAP machine, and it's a little mask that covers the mouth and nose kind of like this, or it will just cover the nose or just the mouth, depending on how they sleep and breathe. And that actually mechanically helps them ventilate so that they don't stop breathing. It makes sure that they get at least 12 to 14 respirations a minute while they're awake. And that's besides weight loss, that is one of the major treatments for sleep apnea is that CPAP machine. Sometimes they have to have surgery to have that deviated septum fixed. Also, people who have one of the first things we see with sleep apnea is people who snore for a long period of the night and it's very loud. Most often they end up having sleep apnea, or they'll wake up kind of snorting, wake up gasping for air. Those are people who tend to have sleep apnea. So it's obstructive sleep apnea is when either a deviated septum or weight is causing someone not to be able to breathe effectively during the night. It's obstructing their airway for seconds, multiple times during the night. Hay fever is something we think about. Many of us have. It's also considered seasonal allergy. So those of you like me right now, I tend to have weird seasonal allergies. I have more in the winter. in the fall than I do in the spring. A lot of people have a lot of allergies in the spring. They can be pollen related, ragweed, grass, molds, different things can cause these seasonal allergies. With allergies, it has very similar symptoms to the common cold. So you have a runny or stuffy nose, runny, watery eyes, itchy throat, drainage. A lot of people will use medications like Flonase. If it's nasal related, they may take Allegra or Zyrtec or something along those lines, some kind of antihistamine to help with those. Sometimes they take them every day. Sometimes people's allergies are so severe that they have to go see an allergist and may have to get allergy shots once a month or once a week, depending on how it works. But those are the things that we see that people use to treat seasonal allergies. Tonsillitis, pharyngitis, laryngitis, those are upper respiratory issues that have to deal with the throat and the throat. They can be bacterial or they can be virus related. With tonsillitis and pharyngitis, that's an inflammation or infection of the throat and the tonsils. We see those a whole lot in kids. Tonsillitis, pharyngitis, they are laryngitis. They are, if they're viral or bacteria related, either one. They can be passed from one person to another by drinking after each other, which the cold and flu and the cold and flu, they can be passed just by coughing or sneezing. They're airborne. Tonsillitis, pharyngitis, laryngitis, they're most often passed by drinking after someone or coming in contact with their saliva. Most of the time with tonsillitis, pharyngitis, laryngitis, they will treat it sort of like the cold, where we give your body some time to heal itself, your own immune system to fight it off. Or if it lasts more than a week, sometimes if your fever is elevated, then we'll go ahead and they'll go ahead and give an antibiotic. With laryngitis, most often people have a change, loss of their vocal ability or a definite decrease in it. Pharyngitis, sometimes due to all of the drainage and the coughing, it will strain the larynx, and so your voice will change as well. Tonsillitis itself, the tonsils are the large lymph nodes in the back of the throat. You also have some under the tongue, and they're covered with a mucous membrane. And they protect the oral pharynx from infection. So your tonsils are back there to get bacteria and infection that are trying to get into the body. Sometimes they just become infected, swollen, red. Sometimes it'll even impact the lymph nodes. You guys know that if you have tonsillitis, you have a very bad sore throat. You don't feel like eating or drinking much. And people who have multiple issues with tonsillitis or strep throat over a year period, they may, or multiple issues with ear infections related to enlarged tonsils or inflamed tonsils that don't go back to normal size. Sometimes they end up having to have those removed. They end up having to have a tonsillectomy. So here you can see where the tonsils are. The ones you're most familiar with are these in the back of the throat. Normally, they should look like this. A swollen tonsil will look like this, and it will start to obstruct the airway or the throat at the back. Sometimes tonsils can stay so swollen that they'll obstruct an airway while they're sleeping, and that would be another thing that would cause sleep apnea, and they need to be removed. Pharyngitis is an inflammation of the pharynx or the back of the throat. You do have a sore throat with that. Foreign objects sometimes like food can cause more pain. Hot liquids can make it more painful, spicy foods. Some of those things also can contribute to short-term pharyngitis just because they have caused minor damage to the back of the throat. Sometimes when you have these issues, just breathing can cause soreness and stiffness and discomfort. Falling asleep with your mouth open can cause some inflammation of the back of the throat. Strep throat is a type of pharyngitis that's caused by the streptococcal bacteria. Generally, you have purulent or pussy-looking areas on the back of the tonsils, the back of the throat. It's very red. They do a culture, and they'll give you an antibiotic to treat that if it's an infection. If it's just an inflammation, they may have you take something as simple as Advil to help treat that. And then if you've got a lot of mucus along with it, they'll tell you to take a decongestant. Laryngitis is an inflammation of the larynx or the voice box, and it's characterized by hoarseness or loss of voice or strained voice. It can be caused by overuse. It can be caused by inflammation. It can be caused by allergies. It can be caused by infections. It can just be, you guys will notice after I go this summer, if you take my class more than 1 year, you'll notice, and sometimes your other teachers in class, when we've gone all summer without talking a whole lot, as much as we have to do during the day, because teachers end up talking 8-10 hours a day. At the beginning of the year, we might end up, or after Christmas break or after spring break, we may have a little bit of laryngitis where our voice changes or becomes kind of weak or will crack. And that's just because our vocal cords have not been used quite as much. So that's some other things that can cause laryngitis. Usually laryngitis will heal itself, but sometimes not so much. Also know that with laryngitis, drinking warm fluids, taking anti-inflammatories, those are all things that we do to help with laryngitis. The flu. Now, right now, the flu, and we're going to stop after all we talk about the flu. Right now, the flu is going around. A lot of you may have had it or getting over it, or someone in your family does have it. Flu is a viral upper respiratory infection, and it is caused by flu A or flu B. It has a very sudden onset. Usually you'll start to feel kind of achy that morning, and by that night you're starting to run fever. Or you have a cough or a sore throat, runny nose, chest discomfort, muscle ache. Sometimes you have vomiting with that, or diarrhea with that, with the flu. So just be sure if you start to feel those symptoms, that achy, weak, cough, sore throat kind of thing, you go get checked, because right now is definitely the peak of flu season. Also know that if you're coughing and not covering your mouth, or if you're at school with a fever, you are spreading the flu to your neighbor and to your teachers and to everybody else around. So just be sure if you have the flu, you stay home. There are many different strains, but generally we know we have flu A and B. Although there's been a viral, some kind of virus that has gone around along with during flu season, that you have all the symptoms of the flu: cough, congestion, aches, sore throat, runny nose, vomiting and diarrhea, but you don't run fever, but you feel just as bad. So that's also another virus that can be spread. With a virus, for the most part, our body has to fight it off. Bacteria, it's not a bacteria, so an antibiotic won't help you. And so we send you home and we tell you lots of fluids, as much protein as you can get, and rest. Rest as much as you can, and that's what helps your body heal. Treatment for flu, the only time they give an antibiotic is if we feel like you have bronchitis on top of that, or you have strep throat on top of that, which are some of the things that we're seeing. Flu and strep together this year, or we're seeing flu and bronchitis together, or flu that's turned into pneumonia. We also suggest that everybody gets a flu vaccine every year. Generally, you want to get it in October or November, because it takes about 2 weeks for it to be effective. If you get it in October, late October, 1st of November, then by the time Thanksgiving gets here, when you get around all your family who may be sick, then it's good and effective, and it'll last you through the rest of the flu season. Those who get it in early September or late August, it's not going to last them through flu season. So you want to make sure. Now, just like with any virus, it can mutate from me to you. So sometimes, as it passes around the world, the flu vaccine that we got is not as effective as we would like it to be, because the flu strain is mutated. Also, know that sometimes, even if the flu vaccine is not 100% effective for you, hopefully it helps lessen or helps your body's immune system act more quickly, so that you can, the flu won't last as long. I know a lot of people will say when they get a flu vaccine, every time I get a flu vaccine, I get the flu. Well, sometimes you may get the flu because it takes 2 weeks for your body to build immunities to that flu vaccine. But also remember that when you get a flu shot, or you get any immunization, if you have a younger sibling, when you get an immunization, sometimes you'll run a low-grade fever and you'll feel really bad for a few days afterwards. That's your body working. It is developing an immunity to that immunization. It's building up its strength. And so sometimes after you get a flu shot, it's not uncommon to feel bad for a few days, run a low grade fever. That's normal. That's not the flu. That's just your body's own defense working to build up those immunities. Okay, guys, we're going to stop here. We'll do lower respiratory viruses tomorrow, and then we'll be done with the respiratory system. So you guys have a great day. Thanks, everybody.